Dave Scott Hub Media. Today I'm with Lyndsey from Absolute Home Care. I've had a great opportunity to talk to Jesse and Jamie, who worked for you guys, and they were great, phenomenal people. But now I get to talk to the big boss. Tell me all about Absolute Home Care. How did this come about? Why did you start this? And tell me how it's going.
Okay, so 15 years ago, I started Absolute Respiratory, and we've been in Simcoe. We expanded to Tilsonburg, loving our community, love what we do. Last summer, started hearing from patients, from staff, about, and we've always known it was there, but about the gap in community care outside of what we already did. So outside of respiratory, I let the idea percolate. I talk a little bit to people, get some ideas, and then by the fall, I'm like, we got to run with this. We got to figure out a way. We have, I feel, a really good reputation for Absolute Respiratory. We have pretty sort of standards, things that we do when we provide care. So how can we transition this over to expanded services? We knew that there aren't enough PSW, so personal support, hygiene, in-home care. I knew from seeing patients, from people that my family knows, foot care is highly neglected and highly needed and not enough of in Norfolk County and surrounding areas. And I thought, what else is there? We see people come home from surgery, they can't get out for their physio or their exercise. How can we do that? So I start posting some job postings, meeting with different people. Met with Jessie. She had come to me with great community care. She'd been in Norfolk County for a few years. She's really loving it here. Her grandma is a nurse here. She had all these connections, and met with her, and I'm like, this is it. She's got the ideas. She has the motivation. Met with Jamie. I said, I was thinking maybe hiring a physiotherapy assistant. She said, well, I am, but I also have a kinesiology background. I have this post-grad exercise training. I'm a certified personal trainer. These are all the things that you could do that you couldn't do if you just hired a physio assistant. I said, oh my goodness, this is great. You're hired. Develop a program. Let's figure this out. So January, we start laying out policies, how we're going to make things work, creating programming, and start to roll, just because there is such a need for community care here.
And you, like you said, with Absolute Respiratory, was it those clients that you were seeing? You went, we need to do this. Like, I know when you get something stuck in your head, you're going to run with it. Was that sort of the motivating factor?
Yeah, it really was. And I had actually a relatively newer staff on my respiratory side. Her and I were talking, and she'd been out to it was a patient that she'd really finally started to see on her own after her training. And she's just telling me about some of the things she saw, and his wife, they live at home, and he's our patient, but just some things she kind of noticed with the wife, and they were getting care, but she's like, I don't think it's enough, and what can we do? And she herself, her parents don't live in Norfolk County, but they don't live too far away. They live in Brant County. And her dad has some chronic illness. And so hearing just good and bad of what they experienced there really started to put some ideas in my head and think, like, how could we do this different? And listening to, loved ones or family friends. My mom has a family friend who's a little older. And so things that I would hear that from care, they good and bad, that they were getting. And so how can we take all those good things and just grow them and make that the only experience?
That's amazing. And I think I think you're a big believer like me. People want to stay in their homes. So why not provide those services that can help them, live their best life where they want to be? I think that's critical, don't you?
Absolutely. And I've only ever worked in the community. I've been in business for 15 years. I've been doing this for 17. And that's it. People, they don't want to leave their home. And a lot of people have great family support that can make that happen, but a lot of people don't, or their family has their own family, or they have to work because they have to feed themselves. Like, just because a child can't be there all the time to look after mom and dad doesn't mean they don't love mom and dad, but it means that sometimes if you're there 7 days a week, it's destroying your relationship with mom or dad. But you also have to feed yourself. Maybe you have to help support mom and dad. Maybe finances are tough, so you do have to work for that. It's not a sign that you don't love your parent, that you don't support them, that we can't always be there all the time. So what can we do that can help take that stress off, save that relationship with your parent? Maybe the people don't have loved ones that live close by. Maybe they're the unfortunate person who's buried their children. What can we do to help?
It's that respite, right? It's that break that they need too. And I think that's changing the channel, or having you guys step in a little bit to help out, provides that opportunity to maintain that respect for each other and provide growth within the family, because then all of a sudden that's one less thing all the way around. Like it keeps your parents or your grandparents or something feeling like the ownership of their property is theirs, but there's somebody there just to make sure, maybe they need a couple little things done here and there, to make sure the meds are being taken, to make sure, those types of things are followed through on. And it takes that burden off the son or the daughter or the family. And I don't know, I think it's the way of the way of the future, because we need that support in all the different aspects of life. And we're seeing it, even in the mental health crisis, right? You need that secondary, that other part to help those folks, any folks, get along and have a better day. So that's what you guys are doing, and I think that's critical. One of the ones that I really enjoyed was talking to Jamie and what she does, because of just my athletic background, and talking to her, and what an amazing woman you've got there, and how she's doing it and helping folks. Exercise is critical in any home, so kudos for that.
And that was the thought too when Jamie would bring me things. I originally had the thought of someone like Jamie to help people post-op with their exercises and their physio, because they get one or two appointments, post-hip or post-knee surgery, and then they're left on their own. So my original thought was just someone to help them who knows the skills. But then Jamie, with her background and her knowledge, she's a marathon runner, all these things. She said, yeah, but we could do so much more. And creating those in-home exercise plans so people don't have to buy anything. She can look at their house, see what's safe, what's not safe, make even those kind of recommendations. And hey, you've got this chair, which is great for these exercises, things like that. Yeah, she's been fantastic.
I do want to talk at some point and get to know your PSWs, because the one thing I did find, I think, was with Jamie, was her interest in the person. You know what I mean? Like, it was genuine. Like, she really wants to help. And I think that's probably one of the pre-qualifications I know you would have for your staff. Are your PSWs the same way? Do you feel that way about them as well?
Absolutely. And there's, everybody knows somebody who's a PSW. It's a really popular profession within healthcare, particularly within the community. And like every profession, there's every spectrum of personality on it. But I really try hard to find people that, if we can sit down and have a conversation outside of work and just, have like-minded conversations, talk about things that I know that you're going to be a good fit. And that's something that I've always had with my respiratory therapist and my nurses in Absolute Respiratory. And I, knowing that most of our staff is like that. You feel comfortable, you can sit down. Some of them are a little shy at first, and then you get them out of their shell. And yeah, you think these are people I could go out for dinner with because they have that passion. We try to hire as local as we can. And I think that's a big thing for someone like Jamie. She's lived here her whole life, outside of obviously going away to university. Her parents lived here. Her grandparents owned a business here that her dad had run. So there's that connection to your community. And same with me, outside of going to school, I've lived here my whole life. I love that I can work here in a profession I love. And this is my community. I mean, my family's been here for well over 100 years on both sides. So having that connection is really important. And I think that's a big part of someone like Jamie's connection and compassion for her patients.
Cool. Can you give me some examples of the sort of the extremes you guys can go with Absolute Home Care? Like, I know you can do just like one-off visits. And sort of give folks the idea of sort of how wide your menu is that you can help them with.
Yeah, our menu is huge. So a lot of times people hear home care, they think seniors, palliative, end of term, which is obviously a huge component of any home care business, but it's not just that. So you might be not a senior or a young senior. Maybe you need care post-op hip, knee, back surgery, any of those. So we can provide care in that interim, 4 to 6 weeks. We can come in, help you get cleaned, bathed, get your meals prepped, get you mobile, go with you for walks, things like that. We can help children, whether it's nursing or PSW care, children with chronic illnesses, medical requirements, medically fragile patients. We can help adults of all ages who have cognitive or developmental delays. So they can have passport funding, which is a program through the government to allow that kind of care. We can provide respite care. So it's a whole spectrum of ages. It's, you might want someone in there every day. Maybe your family comes in 3 times a day and they want a break from one of those visits a day. We can do 24-hour care. The only thing we say with 24-hour care is you need to give us a week or so to get everything lined up and get staffing in place. 24-hour care is a little bit more complex because it does require more staffing per patient, but we are absolutely willing to work with what a patient and what a family needs to make someone able to stay at home, recover from their surgery, whatever it is. Maybe your primary caregiver is going away for 2 weeks and you need someone to come in and help out for those 2 weeks and provide that care.
I guess the big thing I would be, in this day and age that I wouldn't understand, and maybe you guys do this, and I'm going to obviously ask you the question. So if someone comes to you and they have no clue what's available to them, like through government programs or funding, do you guys help with that? Do you guys sort of look into that for them? Like, I don't really know, so I thought I'd ask.
Yeah, so a lot of people know of, like, it's had a million names over the years. It started out as ComCare, then it was Community Care Access Center, the LINS, the Local Integrated Health Network. Now their blanket term is Ontario Health at Home. So that's your government funded basic care. Those are self-referred things, and those are funded by the government. What we provide is supplemental or an addition. So we don't chase those contracts. Those contracts are, truth be told, on a caregiver side, I mean, they're excellent for the patients, but on a employer side, they are chasing the money, chasing the contracts. And so when I came up with this idea, let's provide that supplement. So someone might not qualify for CCA or Ontario Health at Home funding, or it might not be enough. There's a lot of rules around it. It's also something where they don't consider themselves an emergency or an urgent service, in that if you call or your doctor calls or whoever puts in that request, they can take up to 2 to 3 weeks before they even come out for their initial assessment. Well, sometimes 2 to 3 weeks is a big deal because they're and I understand their staffing and their mentality and everything around that, but their idea is like, well, if you're that urgent that you need care, you need to be in the hospital. And unfortunately, too, sometimes we don't think about this. Sometimes that primary caregiver is there, you're fine, and maybe that primary caregiver breaks their leg and can't help you, or gets horribly sick with pneumonia and can't help. So, we can come out a lot quicker. We can come out the same day, the next day, that week, get services in place, do as much as quick as we can to help fill that gap as well. Things like the Ontario Health at Home program, you do have to be on that if you want to get on a list for a long-term care, but a lot of people don't want to go to a long-term care or a assisted living home. And they have programs where you could get 4 PSW visits a day. However, those programs always come with clauses. So if you are someone who needs 24-hour PSW care or more than 2 visits a day, you usually get put on a situation where, okay, now you have to take the first long-term care bed that's available. If you turn down that bed, you lose all of our services. So the more than once or twice a day PSW visits daily it's like we don't have resource to do this all the time. So it's a stopgap to get you into long-term care. With the new long-term care rules in Ontario, you may put down your 3 ranked beds as all being here in Norfolk County or even next door in Haldimand County, but you could end up in Toronto. Likely won't happen because they have the crisis here worse in Toronto, but the province has the right to place you in any long-term care bed within the province. So if your Ontario Health at Home care is, okay, you can get 3 PSW visits every day, but you have to take the first long-term bed that comes available. If you say no, you lose all care. So we want to be that stopgap, because a lot of people don't want to go to long-term care, and sometimes people don't quite need long-term care. If they're able to have that help in home, they might not need and they certainly, a lot of them don't need assisted living, but they don't have enough help at home. And I mean, if you look at and you can cut me off, Dave, if I'm talking too much about one thing, but
No,
uh, if you look at an assisted living, and I'm not discrediting our assisted livings in Norfolk County, in Haldimand County, Brant County, any of that, and but they run anywhere from $3,000 to $5,000 a month. If you're a senior who has lived in your home for 20 years or longer, your house is likely paid for. Maybe you already live in an apartment or a rental unit, so you're probably not paying $5,000 a month. Now, granted, in that price, it does include your meals. Most of that pricing, though, for most places, it doesn't include laundry, it doesn't include PSW care, any exercise care, minimal housekeeping. So all of those things then become a cost on top of that as well. Most of them don't include your phone line. They don't include your internet. I mean, there are some assisted livings where you have to pay extra to get a call bell. I've seen patients who are on our oxygen services in assisted livings that don't have a phone and don't have a call bell in the room. That's because
yeah,
it comes down to cost, and maybe the family looked at it and thought, okay, that's a cost we don't need. Maybe mom, dad, they think they're okay, and they may be okay at first without those things, and I understand that, but those things shouldn't be optional. Where if you're in your own home, whether it's a home you own or a home you're renting, those things are already there because you and your family have made those arrangements for them to be there. You spend money on a PSW to come in, whether it's daily, whether it's 3 times a week, or anywhere in between that, for anywhere from 1.5 to 3 hours, makes a big difference because most people don't need help 24/7 that
no,
are in their own home. They
yeah,
might need help bathing, or maybe they need help with their meal preps or just light housekeeping. A lot of people still want to do their laundry, but carrying the laundry from the bedroom to the laundry room, you know, sounds so silly. I've had patients tell me that they have to make their bed in multiple settings, or they just stop making their bed because the physical strength of pulling. And I mean, you got a big heavy comforter and a lot.
yeah.
And I mean, I like a lot of blankets on your bed. That's a lot of weight. So things like that, our PSWs can come in and help. Sometimes you just want someone to walk around the block with you. After they help you get ready and up and rolling for the day, maybe you want to work on a puzzle together. Maybe you want to craft together, whatever it is. It's more affordable. I know that price always scares people, but when you look at dollars over cents long term, being in your own home, having all those comforts that are already there, it's much cheaper than an assisted living.
I always think too. I had a friend a few years ago who passed, and he was just about in his 90s, and he had dementia. But I would go once a week to visit him because he was just such a good friend, and you saw the deterioration, and you understood. But I just thought, wow, like he just wants someone to talk to. It was that
Yeah.
simple. Just
And
someone to
that's,
hang out with them, right? And I mean, your guys, I bet, that's part of it. As you age, you kind of get restricted. You know, going out and doing things and being social, kind of lose some of those things, and then you don't have anybody to talk to. But just being able to have a conversation with someone, I think, makes such a big impact on their lives. It keeps them going. It gives them things to do and reasons to do it.
and when you have those conversations, when someone's helping you around your house, even just keeping company, whatever it is, obviously they're going to chit chat as long as you want. If you're someone who doesn't want to chit chat and you want to be left alone, that's completely up to you. But
Yeah, yeah,
having those conversations, it enriches both the patient's life and our lives as caregivers, right? You start talking about, oh yeah, I did this on the weekend, and that patient might say, oh, have you ever been here? Like, I used to love going there, or my kids love this, or my grandkids love that. Or you might talk about something you did with your kids, and then they might say, gee, I should tell my kids to do that, with my grandkids, or whatever, right? You start just sharing things. And I mean, I've always seen that with my patients on my respiratory side. You just start talking about
yes.
stuff as you're working with them. You learn all kinds of stuff. The things I've learned over the years is just incredible, random and not random.
And they'll know people that your grandparents knew.
Ab-
Like there's that whole
Absolutely.
community connection again that comes forward with
I,
those
the
conversations.
the best story I have with them knowing your grandparents. A number of years ago, I had an home oxygen patient. She was on our service for a long time, and I sort of knew who she was. Where through like her kids, kind of my mom. I thought, yeah, I think they like probably knew my mom. Whatever. You get talking with her one day, and it turns out she had been my grandmother's childhood best friend, and
Oh, so cool.
she had been with my grandmother the day my grandmother met my grandfather. I'd never heard this story from my grandparents. I wasn't super, super close to them, but learning that story of how my grandmother met my grandfather from her friend who was right there, like that just was so cool. And then, it turns out I had gone to high school with her grandson. He was a couple years older than me, but I knew who he was. And, I thought, oh, I never knew that about him. And when she passed, they had, she'd wanted a private family visitation, and her daughter, or her two daughters, called me, and they're like, if you're around, we'd love for you to be able to come to the visitation. And I mean, of course, because I was just devastated. But yeah, that connection in your community, and that's a big part of why I like to make sure that my staff have that local connection.
I agree 100%. I mean, that makes all the difference in the world when you're, when you're learning still on the job and you're helping someone, maintain their quality of life. I think what you guys are doing is critical. I think it's just
Yeah.
going to keep growing. And you got anything else you want to add?
I think that a big thing that we have seen a huge growth in, so I'll do a little extra plug for it, is our foot care. So our foot care,
Yes.
a lot of people, I knew this was a thing because I would always see people looking for foot care. But then when I would see patients or seniors that I knew just personally, and I would look at their feet, and I mean, everybody's feet deteriorate as you get older, right? A lot of things don't or look okay at first, but everybody's feet. So don't let anyone ever shame you about your feet, because everybody's feet start to look a little different as they age, and they're unable, whether they don't physically have the strength or they're not sure what to do. So that foot care component, especially if you have other health conditions, cardiac conditions, diabetes, getting proper foot care. So our foot care is done all by advanced foot care nurses. So they've all been through additional training, and we can do it in their home. We have been starting to run location clinics. So we've done a clinic within our office. We have clinics coming up at Rolston's in Port Dover. We're working with the Norfolk Community Help Center in Langton to try and get some services there, because that's certainly an underserviced area of Norfolk County. And when we reached out to the director there, she was so excited a health service was wanting to come to them. We've done them in clinic. Today we're actually running a foot care clinic in our Absolute Respiratory Tilsonburg office, because we've got the space there. So that's something that, people are always looking for, always seeing posts for, and it's super important to take care of your feet.
I didn't know that was such a growing concern. Thanks for bringing that forward. That's that's an aspect that we don't think about too much, do we? As we're not, we're still pretty young, so we're not really considering that yet. But obviously, you guys are on top of that for folks that need it, and that's that goes probably hand in hand with like diabetes and everything else, right?
And it's something that is not funded at all by OHIP. So foot care, whether it's done by a foot care nurse or whether it's done by someone like a chiropodist, there isn't OHIP funding. There's very little, certain situations, certain things your doctor could do, but that basic foot care, whether it's done by our nurses or done by a chiropodist, not covered by OHIP. Covered by most people's health insurance, though, which is the bonus. So, and our nurses are very good. They know that, okay, this is outside of our scope of practice. And I have a friend from school who is a chiropodist. So, we say, okay, you know what? You need to go see her because this is outside of our scope. We've done what we can do. Or maybe they need orthotics. We don't do that kind of stuff. Diabetic compression socks. We don't do that. I mean, our nurses know about it. They know when to recommend it, but we refer to that next level of care. But again, something that people aren't getting, they're not getting, no matter who they're getting care for, you're not getting it covered because it's not covered anywhere. And so, it's there. We can do in clinic and in home.
That brings up a good point. I mean, this will be my last one. I know I'm keeping you, but when you just said if our nurses notice, isn't that critical? Because they're in homes, they're going to pick up on those little things that maybe folks need other help with, like the foot care, or maybe, there's that fridge full of sugar that they probably need to cut back on and all those things. So yeah, you guys, when you're in home like that, it becomes, you're part of it. You know what I mean? You become part of that person's life and help them in other aspects that maybe they don't realize they need help in beforehand.
And I think that's really something that when you're looking at a company like us, where it isn't just the factory government funding services through, we're seeing the total picture. Our patient history is extensive when we do nursing intakes. And because, we're a division of Absolute Respiratory, we've written policies. Okay, a PSW comes in and someone's witnessing these things. This is what they should do. They should either call 911 or, talk to the nurse. The nurse manager can then get one of the RTs out there. So and same on the other side when we're in their respiratory doing oxygen assessments and follow-ups. You say, you really need this. Like, can I have somebody come out and see you? It allows us to be able to have within house huge cross referral, but then as well, because we're here, we're local, we know our community, we want to support our local other health providers. We also have that network outside of what we offer.
Wow. A lot of information today. Thank you for taking the time. We're going to have to get together again and do another part 2 because I don't think we got through everything. But
No, but
keep up the good work.
yeah, no problem. I love what I do and I could talk about it all day.
Perfect. We'll talk again. Take care.
All right. Thanks, Dave.